Thank you.
Good afternoon, Chairman and staff. Again, I'm Eileen Coons, Site Director at Pasadena's Huntington Hospital site, and we serve 370 people each month. And I can't give you the exact oldest age because I think that's a HIPAA violation because there's so few people of that age, but it's well into the 100, above 100. But we serve as a statewide association, certainly true at my site, very diverse population, the oldest, frailest, and poorest of seniors that want to remain in the community. And I just urge you to leave open this ask for additional funding. And also, mine is a site that has seen, we're in Coordinated Care Initiative in Los Angeles County. We've seen our wait list double in size. We've seen our wait time triple in length of time that people wait for the services. We've developed much stronger relationships with managed care out of necessity. In the last 2 years, in the absence of CCI, would have had executed 2 contracts to deliver MSSP services, one fiscal year followed by the next fiscal year. I have executed 14 contracts in that time. The number of monthly reports, weekly reports, thousands of pages of document uploads, administrative staff that have had to join us to help us manage all of these things. My time being divided to do all of these administrative tasks takes our eye off the ball of being able to continue to serve these oldest, frailest, and poorest seniors. And so CCI, I feel right now, these are people that cannot survive with usual care in managed care. They need specialized case management services. They need the expertise that we've developed over 30 plus years. And I just ask that we stop the insanity of trying to make this work and acknowledge that there's much bigger issues going on, and this one's got to be able to, we've got to be able to continue to execute well on what we do well and let these other things get worked out and then figure it out on the back end.
Thank you.
Thank you.
Hi, I'm Teresa Ogan. I manage the MSSP site for Sacramento, Yolo, and Placer counties. We serve 276 participants. And I can't really say anything new, the same issues that everybody else has. And I just was kind of going to echo what Eileen said about we're not a CCI site, but we're already paperwork overloaded. And I can't imagine being a CCI site that has additional paperwork on top of that. We're pulling the attention away from our participants and putting it in the office doing paperwork. And as Barb also mentioned, all of our vendor costs are going up and our income isn't. And so really, again, an ask to support the stabilization of MSSP funding. Thank you.
Thank you.
Good afternoon. I'm Richard Strange. I've been the site director for Napa and Solano MSSP for 10 years now. I've been coming to these hearings for most of those 10 years, and each year it gets a little more dire. The situation gets a little more dire. Certainly since 2008, we've had 9 of the sites turn over, and because of funding problems. And we desperately need the funding augmentation, increase the rate so that we can continue to do what was originally authorized 30 plus years ago. It's kind of crazy to think that any organization could continue to function on a funding structure that was set up so long ago. We can all tell you lots of stories about the clients and the needs, and there's so much that MSSP does over and above what's contracted because we constantly come into contact with clients who are not eligible for our services. And so we're actually referring them to other services, making sure they're connecting with the VA or they're connecting with IHSS, they're connecting with other organizations. And we bring an added value to other organizations and to other services by helping stabilize them because we are frequently in the home and frequently talking to the clients, and we see that the biggest risk for folks who are living independently in the community is quite often not their own failing health, about the challenges that are facing their caregivers. And so because we have so much contact and so much hands-on support, we're able to stabilize their whole system, which is essential for helping folks live in the home.
Thank you.
Clay Kemp, Executive Director of the Area Agency on Aging of Santa Cruz and San Benito counties, and also the California Association of Area Agencies on Aging legislative co-chair. And from both organizations, we just want to express our support for this program. It's a great program. You've heard all the stories, all the reasons why to do this. We especially want to emphasize the request for a per rate increase. We think it's fairly obvious, but still needs to be emphasized that if a program works, you can't hold it stable over 10 years and expect to do the same thing that it always does. So we just encourage your support.
Thank you.
Good afternoon. I'm Tippi Irwin. I'm Director of the Ombudsman Program in San Mateo County. And San Mateo County, of course, is considered one of the success stories for the CCI. I want to talk about unforeseen consequences, and in part, this led my comment earlier that I got up and spoke about. I'm specifically talking about that piece of this program that transitions people out of transitions people that don't need nursing home care out of nursing homes back into the community. What's happening as these people are transitioned out, there are a couple of things. Number one, they're looking at the paperwork. This person doesn't qualify for nursing home care, so they've been identified. I believe 200 people have been identified in our county for transitioning out. But they're not taking into account the human element. So what we're seeing is because they don't qualify on paper for nursing home care, they qualify for being moved out. They're selected on paper. So we have an 88-year-old that's selected to be transferred out of a nursing home. She's extremely frail, but does not need nursing home care, given we agree with them. But the problem is she's been there 6 years. They transfer her out to a small 6-bed facility against our advice. The woman gets into the facility, she stops eating, completely stops eating, and becomes exceedingly combative, attacks the administrator in the facility and visitors that are coming in. So at our insistence, she's moved out of that, taken to the hospital so she can go back to her nursing home, and that Medi-Cal will pay for that, only to find that the nursing home is now full. So now she's transferred to a secondary nursing home, and then from there again to another assisted living facility. So we have 4 transfers basically for this woman who's already suffering from transfer trauma because she's been identified on paper as ideal for transfer without taking into consideration the human element. So there's a piece missing there that I wanted to address. There are other issues. I'm not going to raise all of the issues, but there are issues. That's as far as I'm going to go. There are other issues, but I'll leave it at that. Or maybe I should say something. It's about.
How about your final comment?
Well, in the past, what we've seen, there was people that in assisted living that had run out of money, were qualified for Medi-Cal and transferred to nursing homes. Not a great idea, a very expensive way of dealing with it, but it's the way California has always dealt with it in the past, which is why we end up with all these people in nursing homes who don't qualify for nursing home care. Now what's happening, they're running out of money in our county. Age 93 is one of them. Has run out of money. She said, I've done everything right. I'm almost done.
That's not related to you.
Oh. Okay.
Final comment.
She's run out of money, and she's now talking to us about suicide because they will not transfer. She can no longer qualify for Medi-Cal and go into a nursing home because now they're transferring those kind of people out of nursing homes. So unforeseen circumstances here. And we've seen 3 people in the last 2 months in that exact same situation, all threatening suicide because they've run out of money and there's no safety net for them anymore. So just some consideration to be given to these kinds of situations. We've taken away the safety net without putting in place something that replaces it. Thank you.
Thank you. Public comment?
Mr. Chairman, John Pointer, this time Vice Chair of the Orange County Senior Citizen Advisory Council. I'm speaking to you today as a private citizen. I echo all of the comments that were made here. I've witnessed firsthand both programs. I urge passage. Thank you.
Thank you. Are you here for public comment? Are you all here for public comment? I want to thank all the speakers and to say this, that first of all, to all the providers and to all your staff, just a huge thank you for what you're doing for a very, very important part of our community. A few things were said that I think need to be addressed and should be addressed is that when it comes to caring for our seniors, we should never ask our seniors to beg. And many of you have made reference to, people begging for help. And so we have a responsibility, and government has a responsibility to care for the most frail, and certainly for our seniors and those who've cared for us. Clearly, another speaker referenced coming to this committee for 10 years. And I thought about that, and I thought about how the last decade has really been about making devastating cuts to our social safety networks and our health networks and our education networks. And so, I feel fortunate to have arrived at a time where we are beginning to restore some of that, and we've done some of that. But to restore all that has been cut, we couldn't do it fast enough to properly restore all that has been cut. And clearly, this is not agendized for action today, but it is a compelling issue that we will continue to discuss as we move into, the mid-year revise and the final budget negotiations. And this committee will take this issue with all the seriousness that it deserves, and we'll try to consider that in addition to all the other areas where we also need to make decisions to help to restore all that has been cut. But clearly, we have to prioritize those who are the most frail and most dependent on the state of California. So I want to thank all the speakers. I do want to ask our panelists one final question about the discussion around rates and dealing with waiting lists and things of that nature. I wanted to know if there are is there a place for stakeholder input into those conversations, and is there a work group, is there a rate study that takes place so that there are ways to look at how our programs keep pace with just the cost of running them and providing quality care? Do we have a rate study and ongoing rate study, and do we have a working group where stakeholders can give input about the real cost of, one, providing the service, and as one of our speakers said, the human cost of not making the types of changes that have been asked for today? What do we have?
So in talking about the rate study, from the perspective of the managed care plans and the CCI, I know there are ongoing discussions that DHCS has with managed care plans about rates, but how that relates to MSSP, I really couldn't address. In terms of stakeholder engagement, I know that we, the California Department of Aging, have regular conversations with the MSSP Site Association. And MSSP sites, we have pretty open communication about issues. And we do bring DHCS to MSA conversations, and there is the opportunity for those issues to be raised and, as possible, addressed by DHCS. There's not, with regards to CCI and the implementation of CCI, I think MSSP sites managed care plans are still waiting for direction around the stakeholder process having to do with transition. A lot of questions came up about that back in October during the retreat, and that's still something that's under development. Outside of that, those are the two real opportunities for stakeholder engagement that I can think of.
We're going to continue. Did you want to add something, Ms. Sliker?
So around rates, there's never been a formal process that I've been aware of as an MSSP provider to weigh in on that or any kind of surveying of that. Going back to an earlier comment when Mr. Long was explaining the rate structure of CCI, and you said maybe I could shed light on it, no clue.
Got it. We're gonna keep a running list of questions for the department and for our conversations going forward. I really appreciate everyone's testimony. Thank you very much. I want to get to issue 4. We have the long-term care ombudsman program, and we want to get them up here. Thank you to our witnesses. Thank you, Ms. Leiker, and thank you, Mr. Long and and Ms. Connolly. We welcome you to continue here, and we invite up Hester Kleines-Tecker from the State Long-Term Care Program, Ombudsman's Program, as well as Krista Chalemidos from Senior Advocacy Services for Sonoma County, and we'll have finance and LEO and public comment.
Great. Joe Rodriguez, the State Long-Term Care Ombudsman, is at a conference back east, so I'm actually going to do the overview and the update, but Hester's here just in case you venture into technical questions that are deeper into the program than I would be able to respond to. We were asked to give an update in 2015-16. An additional $1.4 million was provided to the Long-Term Care Ombudsman Program. $1 million was one-time only funding in general fund, and the remaining $400,000 was from the Department of Public Health's licensing and certification program, the skilled facility bed fee. And we were asked to just give an update in terms of how that funding has been used. And there was a focus certainly in that increased augmentation in terms of additional unscheduled visits to facilities that weren't complaint related, but just being in the facilities on a regular basis, the skilled nursing facilities, but specifically the residential care facilities, of which there are many more here in California. So if we took a comparison, just since we're in a one-year time frame, and looked at one quarter in 2015 versus 16, we just provided an update on a couple of key factors that are in your agenda, but I just like to call out a couple of them. There's been and we're looking at quarters, 27% increase in the number of ombudsman information and consultation visits with individuals. During these sessions, the ombudsman representatives provide information about long-term care, respond to questions that residents or family members may have, talk about a resident's rights in the facilities and other issues that they may have. And that has, its percentages are one thing, but then there's actually the numbers. That equates, in comparing those two quarters, with about a 2,700 interaction increase in those two in that quarter. As well, just wanted to reference a 13.9 increase in the number of visits to residential care facilities. Again, these are unannounced and not dealing with in response to a complaint. And this is about a 570 visit increase between those two quarters. And then in terms of skilled nursing facilities, a 6.2 percent increase in the number of skilled nursing facility visits in those quarters. And then just also wanted to call out a 17.8% increase in the number of paid staff. The Ombudsman Program, as you know, relies on a small number of paid staff and a large volunteer pool. So this 17.8% increase reflects 27 new paid staff in the Ombudsman Program, which is very important in terms of supporting the work of those of the volunteer ombudsman. And equally as important is that 54% increase in the number of trainings for the local volunteer ombudsman to help support them and keep them abreast in terms of issues that they're seeing.
Thank you. Any additional highlights related to the program? Real brief, I want to get to the proposal as well.
Okay. No, I think Laura covered everything unless you have questions specifically.
I don't. We know this is an intensely valuable program, and we appreciate the updates about what's been able to be done in this year. Thank you.
Thank you.
Hi. Welcome.
Hi.
Thank you.
My name is Krista Chalemidas. I am the Executive Director of Senior Advocacy Services. I'm the Program Manager of the Ombudsman, and I am the Vice President of California Long-Term Care Ombudsman. And they told me I had 2 minutes, and I think I'm done using all my titles. I wanted to thank you for the funding that we received last year and for the opportunity to speak to you in regards to the $3.6 million that we're asking for the balance. As you know, last year you guys authorized bipartisan support for $5 million. It was wonderful. We were very excited, and we were very grateful for the 1.4. But I wanted to put an emphasis on how cost-effective our program is. Last year, I'm Sonoma County, with my modest increase, I was able to certify 15 new volunteers. The numbers on that translated because of the volunteer hours, they paid for themselves in 4 months with their donated hours. We are really effective in using our money. My coined term is I can turn a dime into a dollar, but I gotta have a dime. We are very, very good at making things happen with a little bit of funding. One of the things that's critical that I think you guys know is we solve problems, bad practices before they become harmful. We're preventative in nature. We are acutely aware of all the issues that surround the licensing bodies and their ability to resolve complaints. Last year, she gave you some percentage increases, but the Ombudsman investigated 40,589 complaints. They delivered 47,943 individual consultations. What if even half of those ended up in licensing? They would be flooded under the impact of that. So with your support again this year, we hope that the Ombudsman will be positioned to help against the tidal wave of people who need our services. And thank you again for this opportunity.
Thank you. It was very well managed on time. Thank you. Anything from finance? Anything from the LAO's office? Any public comment? Public comment will be 1 minute each. We ask you to be brief with your comments.
1 minute each.
And you can go less than 1 minute.
Amen. I just want to tell.
A chair appreciates brevity.
Am I being cautioned here? I just want to say one thing, and that is for all my passion on all this other stuff, this is still my number one priority.
Thank you.
Carol Sewell from the California Commission on Aging. We strongly support this increase for the Ombudsman program. Having watched my mother go through care in a residential care for the elderly and seeing all the people whose parents never came or whose children never came, they were there alone, the Ombudsman is critically important. Thank you.
Thank you.
Jordan Lindsay with the Senior Services Coalition of Alameda County in strong support of increased funding for the Ombudsman program.
Thank you.
I'll keep it to 60 seconds. As the Executive Director of the Ombudsman Program in San Mateo County, I just want to tell you that we're one of 2 programs only that have received a bequest. And so we are probably one of only 2 programs in the state of California that are fully resourced, fully staffed, and fully funded. And the difference that is made in our program, number one, we've managed to increase the number of ombudsmen from 29 to 48 in the last 2 quarters, which is phenomenal. That's our primary way of having our ombudsman contact our clients is by increasing the number on the ground and increasing the facility visits. We've gone from 77% facility coverage plan to meeting 94% in that same space of time. Phenomenal. I really urge that I've learned not to close my eyes and hold my breath in case it all goes away. But I really urge you to support this funding request. Very sorely needed. Thank you.
Thank you.
60 seconds.
Good afternoon. Lisa Coleman with the California Long-Term Care Ombudsman Association, and we're very proud to have been able to bring this funding request before your hearing committee, and we're just so grateful. We thank you, the chair, for your support last year and the work of your staff. I can't tell you how proud and excited I am to be able to come back and say, look what your efforts produced. How many more seniors' lives were touched? How many more people got that friendly smile from their ombudsman because of your efforts of the 1.4 million? But when I asked for 4.2 million last year, I was not exaggerating. We can't do it on 1.4, and so we did come back for the 3.6. And while we're grateful for the progress,
ask for what you need.
We demonstrated, we did what you asked us to do. And we're asking for the opportunity to do it more and on a bigger scale. Thank you.
Nancy Murish with the Congress of California Seniors. The Ombudsman program is vital to those seniors who, as has been said, don't have family to come and check on them. We need to make sure that licensing issues are okay. We never know where an elder abuse issue might arise, and we need to remember that we are trying to fight the elder abuse, the crime of elder abuse, with volunteers, and we should give them all of the due money we can to keep those volunteers trained and the staff able to do that. Thank you.
Thank you.
Good afternoon. Aaron Lewis for the Consumer Federation of California here in strong support of the request for the Ombudsman's office. Thank you.
Thank you.
Hi, Brooke Whitlock, Regional Coordinator, Ombudsman in Placer County and a couple of other counties. And I want to promote the funding, please. Thank you.
Hello, my name's Nicole Howell. I'm the Executive Director for Ombudsman Services of Contra Costa County, and I'm so pleased to present to you. I represent 9,000 residents who live in 431 facilities, 3,000 of those who have complex medical issues in skilled nursing, and who have a complicated issue that includes not only medical, but family and social issues. And I think what's interesting about me, in addition to my delightful personality, is that I actually come from another program prior to my time, and I think I'm the only ombudsman in the state to do that. And then I worked in San Mateo County prior to my time in Contra Costa County. And to highlight the difference, we serve about the same number of residents, but they complete about 700 more cases a year than what my program can do. I have the equivalent of 3 full-time staff members, and in the last federal fiscal year, we closed 523 cases, visiting only 12% of our board and cares. Since the increased funding, last quarter alone, we visited 74% of our board and cares. The additional funding and the redeployment of resources and increased volunteer training makes the difference. Our residents deserve to not just be visited once a month or once a quarter, but to know their ombudsman and build trust over time with faith that they will resolve our issues. I truly say that a well-run program can not only address issues, it can reduce antipsychotics, help serve on hospital readmissions issues, and actually change the culture of care. But we can't do it if we're running around just trying to keep our light bill on. Please support this funding. We really will do what we say. And I can tell you in my county alone, I've seen a tremendous change in just the 6 months since I've actually seen the increased funding. Thank you.
Contra Costa in the house, right there. So, yes, San Mateo is the model county, and they trained that ombudsman, and she has come to Contra Costa, and she has changed the face of what it means to protect our elders. And I just want to give you a little tiny anecdote. I have a girlfriend whose uncle, who died at 92, was in a boarding care facility, wealthy family, and one of the caregivers in that boarding care facility took all of his money. He was left with nothing, and that's a wealthy family with representation and advocacy. There are tons and tons of seniors without that. And with ombudsman services, we can ensure that people have some sort of a protection. And the amount of training that it takes, can you imagine asking people come and work in a skilled nursing facility for free? Nobody wants to go in there. So they do amazing work, and I can't support this ask enough. Thank you.
Thank you.
Good afternoon. My name is Isaac Taggart. I'm the Field Service Coordinator for the San Francisco Long-Term Care Ombudsman Program. I'm before you today to emphasize the importance of one of the core components of our program, and that is the quarterly unannounced monitoring visit. These visits allow us to identify issues before they become major crises. Just last week, I was conducting a monitoring visit at a facility. It was a assisted living facility, a nice one. And during the course of that visit, I encountered a resident who was in her room alone, and she had severe swelling across her face and her nose, and her face was red, and she was complaining of arm pain. It appeared she had fallen. And talking with the resident and with caregivers, the resident had indeed fallen, but she'd fallen hours before I had gotten there. And the caregivers had failed to call 911 or to notify the administrator because they were afraid they were going to get into trouble. Needless to say, the resident was sent by ambulance to the hospital to be treated for what was a fractured nose, and injuries to her arm and shoulder. But those are the kinds of visits or the kinds of issues that we address during those visits. And with increased funding, we can conduct more of those kinds of visits.
Thank
I ask
you
for your support. Thank you.
Thank you for your testimony.
Nicole Wortleman on behalf of Ventura and San Bernardino counties in support of the funding augmentation. San Bernardino County has the largest geographic area of any county in the nation, and they have fewer than 4 full-time positions for their ombudsman. They barely survive with the help of volunteers.
Thank you.
I'm Gary Edwards, Executive Director of Advocacy, Inc. We provide the Ombudsman services for Santa Cruz and San Benito counties. There's I know or think there's a feeling that once seniors do get into long-term care, now they're going to be taken care of, now they're going to have food, now they're going to have medical care. While that may be the case, they're not free of abuse and neglect and the opportunities for abuse. I worked as an ombudsman myself for a couple of years and saw many cases of it. We strongly urge support of this budget proposal. Thank you.